Treatment of a lip laceration sustained in a fall. Figure drawing edit. First, I will provide a brief overview of the foundational Akiyama method suture techniques that will be applied in this treatment. The patient reported a lip laceration caused by a fall, accompanied by profuse bleeding. Although the wound appeared small externally, the lip was completely torn internally. Under local anesthesia, the laceration was examined using a microscope to check for any contaminants, and the area was irrigated with sterile normal saline. Suture techniques in Akiyama periodontology, Akiyama microsutures. AM's method refers to the comprehensive series of microsuturing techniques developed through the application of the three-step Akiyama method. The term, Akiyama perio, refers to Akiyama periodontology, modern periodontal microsurgery. In modern microsurgery of Akiyama periodontology, what is the most essential technique that must be developed? The ability to move linear and rotational motions independently is crucial in microsurgery. Without complex control of both rotation and linear motion, minimally invasive suturing is impossible. In Akiyama periodontology, the most essential development is a grip that allows independent control of rotation and 3D linear motion. This content is quoted from the book, The Three-Step Akiyama Method, currently available on Amazon. From now on, the Akiyama grip will be referred to as the A grip. The slide is an A grip. The A grip has two independent functions of rotation and linear movement. The tip of the index finger and the straight part up to the second joint can be used to rotate the instrument, and the tip of the middle finger can perform linear movement. Characteristics of Akiyama grip. The slide is an A grip. The A grip has two independent functions of rotation and linear movement. 1. Function of rotary movement. 2. 3D linear motion function. Function of rotary movement. The A grip has two independent functions of rotation and linear movement. In this chapter, I will explain the function of the rotary movement of the A grip. The function of the rotary movement rotates the instrument using the straight part between the tip of the index finger and the second joint, but it is difficult to make the straight part between the tip of the index finger and the second joint. As shown in the slide above, the instrument can be stably rotated by placing it along the straight line between the tip of the index finger and the second joint, which is formed by slightly curved the back of the index finger and holding the instrument with the thumb. 3D linear motion is controlled by moving the instrument in various directions using the fingertips and the second joints of the thumb and index finger. It can be moved precisely without interference from other fingers. 3D linear motion is controlled by moving the instrument in various directions using the fingertips and the second joints of the thumb and index finger. It can be moved precisely without interference from other fingers. 1. The back of the index finger is slightly curved, and the instrument is placed along the straight line between the tip of the index finger and the second joint, and the thumb can be used to grip the instrument and rotate it stably. 2. Linear movement uses the tip of the middle finger to move the instrument, move in different directions. 3. This linear movement is independent of the rotary movement function. It is possible to move the instrument while adjusting moderate rotary movement and moderate linear movement at the same time. 4. Rotational and linear movements can function without being affected by other fingers. 5. The three-step Akiyama method aims at one step above microscopic treatment, so this Akiyama grip is very important when focusing on the quality of dental treatments. 1. During micro-suturing with the A grip, the operator's positioning becomes extremely important. 2. It is necessary to position the forearm so that it remains parallel to the surgical field. 3. Suturing is performed with the wrist fixed. Depending on the situation, the wrist may be used, but in principle, suturing can be done without moving the wrist, allowing for stable, precise manipulation. 4. Although the same conditions cannot always be achieved in every situation, this next-generation suturing concept, designed to compensate for such limitations, is a fundamental and essential aids. It is important to position the forearm parallel to the surgical field, as demonstrated in the animation. The micro-modified loop knot simple suture. Why the micro-modified simple loop suture is selected as the primary technique in the AMS, Akiyama micro-sutures, method. 1. While the micro-simple interrupted suture holds the wound at a point, the micro-modified simple loop suture can hold the wound along a line because the loop itself provides distance and contact with the wound. Therefore, it is advantageous for primary wound closure. 2. In cases of postoperative swelling, it allows slight tension adjustment, making it less invasive. 3. After the swelling subsides, optimal tension can still be maintained, promoting faster and superior wound healing.
The 20th winter's magic glow fill my stocking with love, you know.
Lip lacerations often have deep internal damage. Careful irrigation is needed to remove contaminants and check the true depth of the wound. Under the microscope, the procedure can be performed faster than with the naked eye. Without the three-step Akiyama method, the same technique is difficult to perform. The suture used is 8-0.
It's already granted was the answer I gave.
To achieve primary healing of a lip laceration, the depth and direction of the needle must be recognized in 3D, and the needle must pass precisely through the lip tissue using the A-grip technique. Because the injury was caused by blunt trauma, a high level of skill is required to align the wound accurately. 4 stitches were placed to avoid scarring. Immediately after suturing, the swelling of the lip decreased. The three-step Akiyama method is not only for dentistry.